Thank you for joining us on 96.3 Nation FM, where good music lives, or anywhere actually in the world on ntvkenya.co.ke/Nation FM. My name is Mariam Bishar.
Most bankable host Brian Eseli. Thank you for choosing us. Right now, we jump straight to the papers. Some of the stories making the headlines, and of course, it's an update because this headline captures the attention of so many, and there's different reactions from different stakeholders and leaders. And of course, the headline reads: "The problem with SHIF." Social Health Insurance Fund. We know that there's a transition from NHIF into SHIF.
That's right. And there's a few problems, obviously. The first one being that a lot of stakeholders feel that they were not involved in policy making as far as SHIF is concerned. And the big question of why not just make NHIF more efficient? Why they need to transition to SHIF and a whole entire new social health insurance fund? A lot of employers feel that they were not included when it came to the execution and the planning and the creation of SHIF. A big group of employers actually is the Teachers Service Commission and other groups who feel like, you know what, we were not included in this. So how exactly are we meant to implement something that we were not a part of from the beginning? Employers also feel that there's already so many deductions that go from employees' salaries. Adding another one when there's no clear benefit and where the benefits don't outweigh the cost is also going to be a bit tricky.
And sometimes the big question is improving what exactly? Because as we look at that, there's public skepticism remains over effective SHIF to be one of the things that the services are said to be improved, but they can't be improved simply because Kenyans have not seen a system that works. Implementation issues are also simply because is Kenya now in position to actually carry out this digital health solution process? And as we look at that, there's been a complaint, especially led by Law Society of Kenya Vice President Kabata, who says without public participation there is no mandate. SHIF is unconstitutional and has no basis in law. We urge Kenyans not to succumb to pressure from the Kenya Kwanza government. They should not pay. We will be going to court to defend the rights of all those who refuse to pay.
That's right. So there's also challenges with the poor consultation of critical groups like healthcare professionals and insurance providers, aside from employers and of course the general public feeling caught unawares by this. Also, healthcare professionals feel like they were not included. Also, it feels like people will be forking out more money for less care as far as the scheme is concerned. Then there's the big issue of exactly how it will be implemented. There doesn't seem to be a clear framework. There's a few experts who were interviewed for the Daily Nation, and you can read that on page 6 and 7, including William Kaimosi, one of the members of the Association of Kenyan Insurance. He argues that involving private insurance and SHIF can enhance service quality, and of course states that they should have been consulted from the get-go. So there's a lot of issues, of course, even as we start to figure out the rollout and how that will look. There's still a lot of questions. There was mandatory registration of school-going children that was to happen, that was halted by the court. The court did declare SHIF illegal at some point. So then where do we stand? How do we move forward? How do we ensure taxpayers' money isn't wasted?
But the only problem with the country that I live in, and for the years that I've been a Kenyan, is that even if it's termed unconstitutional, even if it's termed illegal, it does not mean that it will not be carried forward. We just mix the notes in between politics